In this segment, we want to introduce a discussion about feeding tubes. The PAL is probably not going to readily accept the need for a feeding tube. The problem is that the feeding tube has to be put into the PALs before they need it. Their lung function has to be at a certain level, and their overall well-being has to be at a certain level medically in order to accommodate the operation and the placement of the PEG tube. And if they wait too long, they can't get a PEG tube. So the neurologist here, who I spoke about in a previous video, is very important to be able to overcome the reluctancy of the PALs to get a PEG tube or get a feeding tube installed. And the neurologist has to stress the fact that they are going to lose their ability to eat completely, and it's going to happen rather quickly, and they need to get a feeding tube, otherwise they have no way of getting nutrition without intubation. So it's a very emotional time for the PALs. It's an emotional time for you. It's a very serious benchmark. But you need a neurologist that's going to stress and going to almost force the ALS patient, the PALs, to confront the issue and get a feeding tube while they can get a feeding tube. It's important that you find a gastroenterologist that's going to do this, that's had some experience with ALS patients, not somebody that's never done an ALS patient. It's important that the PALs be given an overnight stay in the hospital to deal with the tube. Normally, in many cases, a feeding tube is put in outpatient and you're sent home in an hour and a half or a couple hours. That can't be the case with an ALS patient. They need to spend overnight in the hospital because of their condition. It's important that a nutritionist be involved so that the nutritionist can work with you to talk to you about what material you're going to use with the feeding tube. We are using a product called Jevity, but you need to talk to the nutrition about if the PALS is still eating something or is taking Ensure, how's that going to be supplemented with the feeding tube, with the Jevity or whatever material you're using there. You're going to have to face an issue of taping the tube down to the patient. And that becomes an issue that you should talk to people about on how do you go about taping it so that you're not going to cause skin abrasion by taping the tube down over the same spots over and over and over again. It's no different than taking a Band-Aid and putting a Band-Aid on and using the same spot over and over and over again. Eventually you'll break down the skin in that area. So the care of the feeding tube, you need to make sure that they give you as the caregiver instruction on how do you use it, how do you tape it down, how do you clean it, how do you work with it. There's a lot involved. It's not complicated. There's just a lot of steps that you got to learn, and you need instruction. So don't let them send you home without instruction and say, oh, you'll figure it out, which I've heard has happened to some people. The other part of it is the nutritionist part, because at that point in time that the PALS gets the feeding tube, they probably are still eating something, so you have to balance what you're going to be putting through the feeding tube versus what they're physically eating in order to keep their weight maintained.